there is a paper which has been published by the union. It is an international union against tuberculosis and lung diseases, which is talking about how vapes and all these other alternatives need to be banned in LMICs or low and middle income countries, which is extremely stupid because 80% of the world's tobacco users live in LMICs, which is extremely horrendous because these are the countries which lack the proper healthcare, they lack proper infrastructure, and they definitely lack the financial strength to actually afford a habit such as smoking. And this paper goes on to say that these are the countries where we should ban these less harmful alternatives, which was very, very shocking and disappointing.
We can put in this is ridiculous. After reading it, it's just like, hey, wait a minute, you want us to go back to smoking? You want all the people to go back to smoking? It's crazy. That's the only thing you can think of, for denying us the tobacco harm reduction alternatives, something that had been proven that is safer. I mean, it doesn't have to be 95% safer. If just like a little bit safer, you should support it, not and you just throw it down to LMIC. It's what? Well, I mean, yeah.
I think it makes tremendous sense from the union point of view. They are a global non-profit and they are looking for ways to expand their scope and their work. Now, 80%, which is 800 million smokers or tobacco users, live in LMICs. So by making such a outrageous claim, what they are saying is that this is now our scope of our work. And of course, they will be pitching for funding because this is where the action is. In Western nations, the war is more or less won. I mean, at least there is no argument on whether these devices and liquids should be available. The question now is how to make them less effective, as Thomas pointed out, by removing the flavor element from them. But in LMICs, this is where the actual fight to save lives is. If 800 million people live in these countries where the healthcare systems are not that robust, which means that when they suffer consequences from tobacco use, they would have the least access to healthcare. Now, in that population, you really want to prevent harm. I can see the central argument from union is that since we cannot regulate, let's ban. But if you are not being able to regulate, and here we have two countries, Mexico and Thailand, where they have banned, but it's not been effective. So what is the net result of what you are proposing? You are saying that we cannot regulate, so therefore, but we will be able to ban it. How will you be able to ban it? Do you have the enforcement or the machinery to implement a ban? You have corrupt departments who are enforcing this ban, and we know this in India and it's already begun, that you can get these products anywhere. So your set goal of preventing teen uptake is actually gone out of the window, because when in a legal market, you could enforce some regulations or some, and there would be self-regulation and reporting from the other players in the market. But now you have none.
The thing is also, you got to consider that when you do a ban, right, you're kind of pushing the problem and pretending that it doesn't exist anymore. Now, if you regulate, that's when you really got to think about it and do something about it. So the easy route is to just kind of shut it and put blinkers on and just pretend that it's not there. And it almost comes across like I don't know if it's right to say, but a colonial mindset, we look down upon you, we ruled over you for so long. Now you're going to listen to us and do what we tell you all over again. I mean, it's horrifying, and that's what it is. If you read the paper, that's exactly what it comes across as.
Colonialism, yes. This is exactly what it is. I mean, it's going to increase health inequality between the Western and the developing nations. Because to one, you give access to ways to reduce harm, to the other, you say no.
They support harm reduction when it comes to HIV, because for sub-Saharan Africa, had it not been for harm reduction, the HIV rates would have gone sky high, but thanks to things like condoms and things of that nature, you see the rates went low. So I don't think that decision was based on any scientific evidence. Countries in Africa here, we have over 100 million smokers with zero cessation services. There's no cessation services offered to people. So if you leave people that way and then you tell them that the very thing that's helping them, they want to ban it, I don't understand what's really happening here.
India has one of the most forward harm reduction policies in AIDS treatment, HIV treatment, and even addiction treatment, where methadone is actually given out through mobile clinics. So when they have gained so much and learned so much from there, I do not understand why that those same principles cannot be applied to a similar problem. And I think that's where a lot of dependence on tax and participation of the tobacco industry or influencing policy, and on the other hand, the role of prohibitionist NGOs and the influence that they wield, I think that is where the problem is.
I think maybe the union is doing what they're doing because whoever is funding them is actually telling them to say that, to do that.
Yeah.
That's just my opinion.
Yeah,
So
just by saying that, they now become party to conversations in LMICs where the smokers are.
Right.
So, for them, it's a great way to embed themselves in a conversation which has little to do with them. I believe there was a union seminar or a webinar where there was no one from the LMIs. And that was ridiculous when you're proposing a ban on LMICs. To have no voices from LMICs in that webinar. I mean, that's exactly what colonialism looks like.
What really makes me angry is that the central idea behind the union's document is that because of the incompetence and the weakness of the authorities in the lower and middle income countries, vaping should be banned. And therefore, instead of helping governments, if they want to helping governments to strengthen their tobacco control, they are just assuming that their tobacco control is going to be weak forever. And based on that incompetence, they are canceling our liberties and our rights to health and to self-determination by banning these products. What really surprised me in the webinar you said is that they never really talked about the ill consequences of such proposition because they don't care about people. But what happens with the black market, as Jay was saying a few minutes ago, they haven't been able to enforce their own existing bans on vaping. How they will enforce a larger ban? What really bothers me is that these countries are just accepting their own weakness instead of looking ways to change it. We smokers or ex-smokers, we vapers, we are the ones that are paying the consequences of their own incompetence. And that really bothers me.